welcome back to the Healthy Living Show. I'm Megan Copeland, your host today, the marketing manager at Hilton Head Regional Healthcare. And we're back again with Dr. Chopade, who is a neurohospitalist for Hilton Head Regional Healthcare. So earlier we talked about your role here at Hilton Head Regional Healthcare. Can you tell us a little bit about the team that you work with here?
Absolutely. We have an amazing team here at Hilton Head as well as Coastal Carolina. Like I said, I work at both hospitals, and we have a very dedicated group of hospitalists and neurohospitalists. I work with Dr. Ricalde, who's the other neurohospitalist, and then we have several other neurologists who take care of patients once they are discharged from the hospital. Dr. Coley, Dr. Warner, these are amazing individuals that I work with. Our entire goal, working as a team, is to provide the best care possible that matches the guidelines laid by the neurology societies, by our peers, by the giants in our field. But it's not just the hospitalists and the neurohospitalists. We have an amazing team of nursing staff here, physical therapists, occupational therapists, speech therapists, and treating neurological conditions is always going to be a team effort. Patients may come in with deficits, they may come in with weakness on one side, and the physical therapist I'll help them with the medications and the acute management, but the physical therapists are the ones that are going to work with them to get that strength back. If somebody comes in with speech deficits, they are not able to get their words out, they're having trouble finding their words, they're having problems swallowing, the speech therapists are going to work with that to help them regain some of that function. Occupational therapists will assist them in providing devices that can help them to prevent falls and things like that. So medicine has been and will continue to be a team effort. We have great doctors here, great hospitalists, amazing nursing staff, physical therapists, occupational therapists, speech therapists, and we are all committed to providing the best standard of care treatment to our patients. Dr. Ricalde is a very experienced neurohospitalist. He's my partner, and we work 1 week on and 1 week off. That means I'll cover 24/7 for 7 days, and then he'll take my place and he'll continue that coverage. So both hospitals will be covered 24/7 at any given time. If I cannot be in the hospital, let's say it's in the middle of the night and I cannot get to the hospital within a certain amount of time, then both hospitals have access to teleneurology. It's an amazing tool where patients can see neurologists through a tele service. The neurologists that we talk to are often at the Medical University in Charleston, South Carolina, and I actually worked with all of the neurohospitalists there, all of the stroke specialists there, and I trained under them actually, and those individuals are amazing individuals. Some of those individuals have been responsible for creating the guidelines that are followed throughout the entire world, and so patients will get excellent care, no matter what time of the day it is. It will be either me or it will be Dr. Ricalde, and if we are not there, it will be somebody through teleneurology.
That's great. So the Neurohospitalist program is new to Hilton Head Regional Healthcare.
Absolutely.
And you're covering both Coastal Carolina and Hilton Head Hospital, you and Dr. Ricalde, for 24/7 care.
Absolutely.
That's Monday through Sunday.
Monday to Sunday.
That's awesome. So earlier we talked a little bit about strokes, and I just wanted to go over, if someone is sitting at home right now and they experience a stroke, what are the symptoms and what should they do?
Absolutely, that's an excellent question. And let me, before I answer your question, let me talk about a little philosophy of mine. As a neurohospitalist, as a neurologist, and as a physician in general, my focus, and I think 99.999% of doctors and physicians would agree with this, my focus is always prevention. If I could prevent every single stroke in the world, I would have achieved my goal.
Good.
Unfortunately, that's not possible because I see the patients once
Right.
they've had a stroke. They come to me once they're having stroke symptoms. If that's the case, then my goal is to minimize the effects of the stroke that is happening right now and prevent the next stroke and the next stroke. It's important to realize that if a patient has a stroke now, that means they have the risk factors to have a second stroke
Wow.
and a third stroke and a fourth stroke. And so my job, my philosophy is all about prevention.
Okay.
If I could prevent strokes. From that point of view, it's very important that even if you're having a stroke right now, and this is your first stroke, you never had any symptoms like this before, please come to the emergency room so that it can be evaluated. So what are the things to look for? Facial droop. When you look in the mirror and you see one side of your face, right side, left side, one side of your face is drooping, that's a concerning sign. I want you to have that evaluated. If you feel weakness, like you're typing and suddenly my right arm is not working, I can't write, I can't hold a pen, I can't hold a spoon, that's concerning. Please have that evaluated immediately. I was walking fine last night. I suddenly woke up and my left leg is not working, my right leg is not working. Please have that evaluated. You wake up and you're fine, you just ate dinner or you ate lunch, and suddenly you're having trouble getting your words out. Instead of speaking fluently, you are having if you're stuttering, or if you feel like your speech is not very fluent, it's not very smooth, that needs to be evaluated. If you have trouble understanding what somebody else is saying to you and you're fine 5 minutes ago and then suddenly this has happened, that's a concerning sign. So these are some of the things: weakness on one side, face drooping on one side, having speech difficulty. Any symptom that starts suddenly is concerning, and therefore that needs to be evaluated.
Right. Isn't there an acronym out there that people share to remember those signs?
There is, and it's usually FAST, F-A-S-T.
Okay.
That stands for facial droop. What else is it? Arm weakness or leg weakness, a unilateral weakness. I'll have to think about it. With speech and
Time.
Time, yes,
Okay.
time is important. Right, that's right.
Yeah.
So facial droop, arm weakness, or I don't like to think of arm weakness. It can be weakness anywhere on one
On your
side,
body.
and then speech difficulty, and then time is paramount because that treatment can happen only within a certain amount of time.
Okay. And so you talked about prevention. What are some of the tips for preventing
Absolutely.
strokes?
So stroke can happen for 100 different reasons. Every patient comes in with a stroke, you have to get to the root cause of why they had a stroke. Some of the common causes, the mechanism of stroke is your heart is right here. Your heart is beating constantly, every second. The blood flow goes to the brain through two major arteries here and two major arteries in the back. If the problem can be in the heart, the problem can be in the blood vessels, the problem can be in the blood vessels in the brain, we have to check all these things. The most common cause, or the more common causes, would be something like a patient has atrial fibrillation, where their heart, instead of beating really well, it's fibrillating, where it's not squeezing as well, and so the blood doesn't move as well as it should.
Okay.
And what happens if blood doesn't move really well? It becomes a clot,
Right.
and the clot can go to the brain and cause a stroke. So if anybody has a history of atrial fibrillation, they are at high risk of stroke. Anybody who has a long-standing history of hypertension, high blood pressure, high cholesterol levels, they are at increased risk of what's called atherosclerosis. Atherosclerosis is a process, it's not a sudden process, it takes years, but as we get older, what happens is our blood vessels, instead of being big, wide open, they start closing up, and that's because there is plaque buildup on the inside walls of these blood vessels. And so that again is not an acute thing, but you can get a clot in those blood vessels that can cause a stroke. So these things have to be evaluated through looking at the heart, looking at the blood vessels, find out exactly why the patient had the stroke, and do what is needed to minimize those risk factors.
And sometimes I know the answer to this one. That's exercising and eating healthy.
Absolutely. I cannot overestimate the need for exercise and eating right. I could give you every single medication in the world, but if you're not eating right and not exercising, staying active, you will not be able to minimize those risk factors. So exercise and healthy eating is very, very important. Now again, I want to stress, when I say exercise, I don't mean that you go to the gym and start bench pressing 200 pounds, 250 pounds, something like that. We're talking about staying active.
Right.
And staying active means going for a walk, a brisk walk. Staying active means playing tennis for some time. But doing it regularly is the key.
Yeah, and this is such a beautiful place to
It
do
is
it.
absolutely
I see people
beautiful.
walking around, riding their bikes and everything, but thank you so much for joining us today, and
Thank
I've
you for
learned a
having
lot,
me.
and I hope